So Spinraza is a newer kind of medications that are coming out. So one of the first things we did when we decided to do this kind of treatment on some of the more complex cases was to have a meeting of all the stakeholders and figure out a protocol, brainstorm and figure out a protocol on how this would be done. For when we do it in children, it's pretty straightforward. We are able to do a spinal tap at the bedside and are able to take care of that. Some of our older patients, their spines are fused because of scoliosis. It's nearly impossible to do a spinal tap on them. We have a couple of options. One of the options is to put a drain higher up and inject the medication. The other option that we have been using is to do a high cervical spinal tap under IR guidance. At MU Healthcare, we are able to provide this kind of care because of the comprehensive team we have built. And we are also part of their registry, which is tracking their natural history and course of the disease so we can understand this better. The numbers are still coming in, and we still think we need a lot more patients before we can make more meaning of the bigger picture of all these. But in my own experience, we are noticing that there is a stabilization in their function, in that the deterioration is being slowed down. We all remember reading about spinal muscular atrophy in our medical school, saying there was no cure, patients died, but this has changed the way we take care of patients.